into the waiting room. Oh, thank you, Laura. So I was going to mention to everyone that we are going to record today, because although we've had fabulous interest and registrations for this event, there are some partners who are unable to attend. So they would like to be able to capture the learnings from today's forum and watch that after the event. So if you don't feel comfortable with having your camera on with the recording, that's totally fine. But of course, we love to see smiley faces. So where possible, if you can keep it on, that's great, but completely understand if not. So please feel free to jump into the chat and introduce yourself and say hello. We will start to kick off. How are we going, Laura? We've still got a couple of people still coming through the waiting room.
Yeah, we still have a few joining. It's very exciting.
It is. Okay, so we might, I think things are slowing down a little bit, so we might actually kick off. I don't want to keep you all waiting, seeing as you've got here on time. So welcome everybody. As I mentioned at the start, in case you missed it, we are recording today's event for partners that aren't able to attend. So if you would prefer to keep your camera off, that's totally okay. So today we have a fantastic range of partners in the room, and a special warm welcome to those new people today who may have not previously connected with WISE through our partnership groups but have an interest in this topic. So we extend a very warm welcome to you all on this beautiful, sunny, wintry Tuesday morning. So firstly, I would obviously like to do an acknowledgement that I am coming to you today from the land of the Bunurong people in the southern metro region of the Kulin Nation, and I'd like to acknowledge elders past, present and emerging, and those present here today, noting that this land was never ceded. It was and always will be Aboriginal land. As I mentioned, welcoming everyone in the room today, but particularly our guest presenters. So we have a couple of those. You would have noticed that we did have Enliven as a scheduled presenter. However, unfortunately, due to sickness, that's not possible. But we have Danny McCaffrey and Sally Rossiter from Star Health. And we also have a special guest, Dalal Smiley, the CEO of Wellsprings for Women, and possibly Kit, our CEO, joining us for our panel discussion later. So also noting that a few of my fantastic WISE colleagues are in the room today and assisting with today's event. So Zoe Francis, who's the acting HP manager, and Laura Riccardi, my colleague in charge of sexual and reproductive health, who is monitoring the chat and working the background for me. So thank you so much for that, Laura. I really appreciate it. Just some quick Zoom room etiquette. If you can all just keep your microphones on mute while you're in the room today, that will minimize any background noise. And we love emojis at WISE, so feel free to get stuck into the Zoom emojis. Clapping, thumbs up, love hearts. We love an emoji. Thanks, Eva. So yeah, I did it the other day on a meeting and everyone was kind of like, oh, and I said, sorry, it feels normal for me, but it's, you know, maybe a bit different. But yeah, we love them at WISE, so keep them coming through. Okay, so today, the other thing I want to mention is if you'd like to ask a question, just in terms of kind of keeping with the flow of the event, if you can maybe put that in the chat and we will address it in the Q&A section at the end. So as I mentioned, Laura's going to moderate that, and there'll be an opportunity within the presentation to also contribute to the discussion too. So to run you through the plan today, as you can see on the screen there, We'll present up front an overview of why, apply a gender lens, some brief theory, and then move to discuss how, with case study examples and opportunities to open up that discussion. At the end, we also request your commitment to participate in a short 1-minute post-evaluation survey. So you would have had to complete a couple of survey questions as part of your registration, which we really thank you for. At WISE, we are very committed to evaluation and measuring the social impact of our work, and therefore we need to do that through pre and post evaluation surveys. So we will provide time for that in session at the end of this, where you can jump on with a QR code and just quickly answer those few quick questions. Okay, so, just whipping back to that one. So we will have a short tea break before we jump into our case study examples with Danny and Sally. Okay, so in terms of our learning objectives today, I'm not going to sort of read them all out there, but I just wanted to bring that forward around increasing our understanding, knowledge and awareness and confidence around the application of a gender lens to health promotion planning and practice, and also an increased awareness of tools and resources available to support that process. I think it's also important to note that we have a wide sort of range and diversity of attendees in the room today. So we have people from local government, community health, we have people from the department, we also have people from the Department of Education. I think we have a school nurse in the room, we have somebody from the pharmacy. You know, this has had wide appeal in terms of, and Jean Hales, I think, is represented here today. So it's really fabulous. And we would hope that with that, you all come away from today's learning forum and discussion feeling empowered and more knowledgeable and confident to apply that gender lens to your work. Also wanted to note that as a women's health organisation with a feminist lens, we will be presenting with this angle. However, we will reference the impact of this, and we understand that obviously gender is non-binary and there is a continuum. However, today's discussion is really just the beginning, and my next slide will kind of allude to that a little bit more. So you may remember in your registration we asked a pre-survey question, which was around if there was anything in particular you'd like to learn about applying a gender lens. So some of those questions or things that you've put up there are now on the screen here, and you can see that the answers were pretty diverse. And I think what it illustrates is the width and breadth of this topic is pretty huge. So in recognising that gender is non-binary, and we've really kind of grappled with how to present all of this within a forum, but I think with the time that we have today, we just need to start with looking at just a gender lens, and then we will start to unpack in more detail the intersectionality part. It's not that we won't speak to that a little bit today, but we will at times speak about the impact on men in this forum. And as we were just discussing at the start, I think Sally was saying, we're just even starting to realise that a gender lens has an impact, and for women recognising that. So this is really the beginning of something pretty exciting, I think. So today's forum does have a focus on that community health angle, so specifically the 3 main health priority areas of the relatively recently released Integrated Health Promotion Plan. It doesn't preclude our stakeholders from council or other organisations or people from benefiting from this discussion. So I think that application of a gender lens does sit across all jurisdictions and disciplines. But as the title alludes to, the focus today is the application of gender lens to health planning. So that will be an angle that we will take today. And as I said, we will discuss that intersectionality and build on this in our next forum. So there will be more. If you like today, there will be more. And there's certainly opportunities to, we've got the things that you're interested in here, and there'll be opportunities through the evaluation too to kind of pick a direction or what interests you most. Um, okay, so I think it's also important to note that we're all in this process learning together. It is useful as practitioners when we draw upon the tools and evidence along the way that we build regular reflective practice into our work, because that helps us to identify the areas for improvement. And through continued attendance at learning forums like this, it's helping us all to network and share our practice and examples as we all learn together in this journey. So just, I guess, taking a short moment to ground the work back to our promoting respect and equity together, which is our prevention of gendered violence strategy, also fondly known as PRET. We love an acronym. And many of you were involved in the consultation and development of PRET last year. So our theory of, this is our theory of change. Well, it's actually half of it. Up the top is the vision that's cut off, but you can see along the bottom our strategic pillars, and today's session is really, as those ticks illustrate, speaking to making people and GE everyone's business. So we're bringing more and more people into the discussion. We're building workforce capacity, sharing research and evidence, and providing a platform for collaboration and networking. And you can see in the middle section there, we also have the partners have strengthened organisational capacity and commitment to apply that intersectional gender lens across their health priorities, services and areas of practice. So Laura will post a link in the chat to those who maybe aren't familiar with our PRET strategy or would like to revisit this. So thanks, Laura, for that. Okay, so I guess throughout our conversation and our consultation for our strategy, we ongoingly are seeing the gendered effects of COVID-19. And this slide here really speaks to the fact that COVID has really revealed women's health inequities further and strengthened the need to take a gendered lens to recovery. So research is showing that during the COVID crisis, women experience higher levels of depression, anxiety, and stress than men. Family violence rates have skyrocketed, and noting the majority of essential workers are cleaners, nurses, teachers, early childhood, and retail workers are women and the lowest paid. So the pandemic has really highlighted those inequities and continue to prevent women from fully participating in the economy and our community. We all know as school-age children transition to remote learning that also childhood centres and care services were closed, that women had to cut back on their work or leave jobs to take unpaid caring responsibilities. And women were also more likely to use their jobs during the pandemic. So GenVic have some fabulous resources here on their website. We will be sharing all the links and tools referenced today with everyone who attends, so that you can tap into those as well at the end. We're all about sharing the love, so they will come out to you after the event. Also on the right-hand side of the screen there, as I mentioned, there are also elements of gender, particularly for men, in terms of, as that bottom graph shows, that men are at higher risk for severe COVID-19 infection and death with COVID-19 infections. And there's also some research around the negative impacts on men's health, particularly reproductive systems. So I think it's important to note that you know, there are negative impacts in different ways for different genders, and that's obviously important to explore in the gendered lens approach. So taking us back to our uni and health promotion theory for a brief moment, hopefully it's not too traumatizing for anyone, but it helps to set the scene. So this well-known graphic illustration of the Ottawa Charter illustrates the 5 key action areas and 3 health promotion strategies of enable, mediate, and advocate. So 1986 was when the World Health Organization released the Ottawa Charter for Health. I was 11 years old then. There you go, showing you my age. it did state that people cannot achieve their fullest health potential unless they are able to take control of the things that determine their health. And its intention was to achieve health by all by the year 2000 and beyond. So we are well beyond that, of course. However, it originally did not address gender as a determinant of health. Had a focus on social determinants such as food, education, shelter, peace, income, etc. But not including gender in this obviously ignores the fact that gender has a huge impact as an overall social determinant of health and the way by which people experience the systems and structures that they exist within. It's good to note that obviously that's changed, and the World Health Organization has certainly brought gender into the fore. Again, you can see this in Dahlgren and Whitehead's social ecological model of health, where a person's gender identity sitting in the middle there in that circle is not referenced, but more around their age and sex, which obviously sex is different to gender, as many of us will know. Sex being the biological construct, gender being the social construct. So a person's gender identity influences and is impacted by all of those social ecological factors and determinants of health. And the way in which a person who identifies as a woman or female experiences work environments, education, unemployment, housing, etc., is very different to a person who identifies as gender diverse, non-binary, and again, very different for a man. So I think it's important to note here that the systems and structures that people exist within can either support equity approaches or promote inequity and marginalisation. So we're going to unpack that more in a second. So in terms of gender transformative practice and the how, so this, as I mentioned, the WHO has moved on since 1986, thank goodness. And this is a diagram from the World Health Organization that is speaking to what is known as gender responsive policy, also gender transformative practice. Those can be kind of interspersed or swapped out for each other. And it's not new to international development work. So the UN Women and the WHO take a gender lens and gender transformative practice to all of their work around health promotion and priority areas, particularly that of gendered violence prevention, but also other areas. So this one here is actually taken from a WHO document around women in tobacco, which we will be unpacking a little bit more down the track. So again, this is another visual representation of that same model on the previous page, just not quite as colourful. Comes from an interesting article by Pedersen down the bottom there, 2014. So as we can see, this is not old news. So it's a continuum from the left to the right. So on the left, we have gender inequity, and I guess what they're calling an exploitation, whereby you've got approaches that are gender unequal and perpetuate gender inequalities, moving right through to gender blind, gender sensitive, gender specific, that's acknowledging the norms and considering women's and men's specific needs, and then finally a gender transformative practice approach, which is where we're all hoping to land with an ultimate outcome of gender equity. So what I'd like to do is, I guess, open it up to the floor and ask if anyone could give us an example in their work around something whereby a program or some sort of work whereby they are seeing gender unequal So perpetuating gender inequalities and what that might look like. Has anyone got any contributions to make? Just pop your hand up and you can take yourself off mute. Don't be shy. And I don't really want to listen to my own voice talking the whole time too.
Look, I'll throw one out there. It's Fiona Cost here from Kindernia Shire Council, and it's something that it's an old one, but it's a goodie. Kindergarten, and the choice when my daughter went to kindergarten, there was only 2 choices of colours for her kindergarten shirt, and it was blue or pink, and very gender specific, very much separating boys and girls. There was no middle, no in between, no non-binary, and it very much reinforced the stereotypes of boys wear blue and girls wear pink. So I'll put that one out there.
Thanks, Fiona. Thanks for that. That's a really great example. And Laura, you've got your hand up too. Did you want to say something?
Yeah, I think that's a great example because it shows that gender norms are instilled and kind of perpetuated and socialized right from really childbirth through to adulthood. And it can seem trivial, but the ways that those stereotypes manifest in terms of health outcomes and economic outcomes later are pretty significant. I think the example that came to mind for me, as Kat mentioned, I work in sexual and reproductive health at WISE, is probably related to STIs and HIV. So I'm sure lots of people are aware that a lot of the sort of focus around STI and HIV prevention is on the men who have sex with men community. And that is, of course, because historically that community has experienced higher prevalence, and some of that has obviously been due to homophobia and discrimination. But I think what we're seeing now is a disproportionate impact on young women's sexual and reproductive health outcomes, with a lot of young women undiagnosed with things like chlamydia, and it does have an impact on women's fertility and their sexual and reproductive health outcomes if left untreated. And so I think having that gender lens in terms of how we prevent, test, treat STIs, HIV, bloodborne viruses is really important because it does impact men and women differentially.
Thanks, Laura. That's a really great example as well. So moving through to the other end of the scale in terms of gender transformative practice, does anyone have an amazing example that they would like to share in that regard with us? Otherwise, I've got one here that I can speak to. So I guess in terms of that gender transformative practice, so it's addressing the causes of gender-based health and inequalities and working to transform harmful gender roles, norms and relations. So I guess if we were looking at a practice whereby we had called women, so culturally and linguistically diverse women, who is co-designing policy for specifically for their own populations and the voices of those communities, helping to kind of shift and change the barriers and environment that are perpetuating gender inequity and inequalities, would be a really great representation of a gender transformative practice and having those voices heard. So I think that gender transformative practice approach is about the work that's undertaken by individuals and groups towards achieving that gender transformative change. So it involves critically examining, challenging, and transforming the gender norms, practices, and structures that create and maintain gender inequality and strengthen actions that support gender equality within that given context. In terms of the how, so a gender analysis is obviously a super useful tool that we can use as a starting point in doing this work. So a gender analysis is effectively a process of, as it says there, considering gender and gender inequalities when analysing data and in program planning. So it informs action to address inequalities that arise from the different roles of women, men, and gender diverse people, the unequal power relationships between them, and the consequences of these inequalities on their lives, their health, and their well-being. So I think that really kind of articulates it pretty well. And on the right-hand side there is just a grab from, it's a bit fuzzy, I'm sorry, but a grab from a report from Women's Health in the North, which is just speaking to the fact that the diverse needs of the community are addressed, which contributes to that equitable and inclusive space. So how this kind of lands, and it would be remiss, I guess, today not to credit the importance of the GE Act legislation, which was adopted in 2020. And we're very lucky, I guess, living in Victoria, given that we are really our state leading the country in terms of this gender progressive legislation. We know many of you in the room today are familiar with the GE Act and bound by that because you're working for a defined entity. As a result, but we thought it was important to link the indicators and understand their connection to the broader gender lens construct. So those 7 workplace gender equality indicators, which are on the screen there, are set out by the GE Act, and they represent the key areas where workplace gender inequality persists. And where progress towards gender equality must be demonstrated by those defined entities, so taking a gender-specific approach. So those defined entities are local and state government agencies, and that also includes education institutions and TAFEs. So they must collect and report data against these indicators on the screen here in their workplace gender audits. And the entities are required to make reasonable and material progress in relation to their workplace gender equality indicators. So this is really kind of an underpinning legislation in terms of this broader conversation. And we will weave throughout the discussion today. As I mentioned before, when we were talking about that gender transformative process, well, it all starts, of course, with gender disaggregated data. So without the application of gender disaggregated data, it's very difficult to achieve a gender lens approach to the work. So where possible, it's really important to push for data that can be interrogated and help to understand the gendered nature of the issue and to be able to respond appropriately. Our government is also, as I mentioned again, leading the way, and we have released in 2021, Victoria became the first state to implement gender responsive budgeting, which is fabulous. And I guess, as it says there, it complements the GE Act and really identifies the areas of need. So the 2022-2023 Victorian budget invests around 940 million in initiatives that are primarily focused on improving outcomes for women. And I think in combination with the Safe and Strong Victorian Gender Equality Strategy and the GE Act legislation I just talked about, these policies are really ensuring that when decisions are made at a budget level, they're doing everything that they can to break down structural barriers that hold women back. And that, of course, allows for measurable outcomes, some real transparency and accountability around that, and improvements in women and girls' participation and overall health through investments in skills and training of women. So what that really looks like. Oh, and the other thing to note is, I guess, this is also not new. So gender responsive budgeting has been adopted by countries across the world. So Canada, France, Germany, Japan, and the UK follow this gender responsive budgeting purpose. But in Australia, Victoria leads the way, which is very exciting. So to give an example of what that looks like, so Head Start is a program which is a statewide support system which provides pathways for students to undertake school-based apprenticeships and traineeships. And the gender impact assessment that was done there recognised that young boys and girls have different experiences of the apprenticeship and traineeship system, speaking in the binary there, but obviously acknowledging that it's not a binary. Women and girls are less likely to access vocational pathways, and when they do, it is often into lower paying industries. So this understanding meant that the Head Start program could seek to increase awareness of male-dominated trades among women and girls students, and increasing this awareness, challenging the gendered norms and looking at the systems and structures that are preventing that. A conscious effort is taken and measured so gender inequality is not further entrenched through continuing with the status quo. So more active steps are taken to work out positive gender outcomes for women and girls. And the same process can obviously be used for people who identify as non-binary, because there would be obviously same and different barriers for those people too. Does anyone have anything to add or any questions or anything at this point in time? Zoe, do you want to jump in? Or should we keep moving?
No, I think that it's great that Laura's posted the link to the budget analysis. That's something we've started doing at WISE, and I think it's really proving high value. I just noted that that link is to the media release, so we're just going to grab the document itself and get it to you either. It's sitting on the website, or we'll email it to you after today. Yeah.
Thanks, Zoe. So the framing is obviously the all-important point when it comes to gender inequity and taking that gender lens. So yes, often in health planning, we reference in our documents or our work vulnerable or minority populations, being those groups that sit along the bottom there, and that's obviously not just an exclusive group. There's more that would sit in there as well. But in doing that, we are targeting interventions towards those groups, but often turning a blind eye to the larger systems and structures that are at play that perpetuate that inequity. So in order to really create equality, it's almost flipping it, moving away from this sort of framing language that in a way is quite victim blaming, labeling, and referring to these, and rather than labeling these groups in this way, but referring to the groups as marginalised by the inequitable structures and systems that perpetuate that gender inequity. For example, a system that doesn't allow for the voices of these groups to be represented, in effect, will never be able to understand or address their need in an equitable way. And this slide here, I guess, when we ignore the systems and structures, which is as indicated by the Red Cross, and we focus purely on interventions for the vulnerable and minority populations and communities, we're in effect kind of perpetuating the issues and the systems and structures that really marginalise these groups and must be challenged and held to account. So there is a real role for advocacy for all of us in our work to kind of shift and change this narrative. And if we just take for a moment the impacts of colonisation on Aboriginal and Torres Strait Islander people, which are outlined in the Passing the Message Stick report, which some of you may have read. it states clearly that the sharing of stories of strength and leadership helps people who are Aboriginal to believe they are capable of making good decisions and support the demands for self-determination rather than telling the victim story all the time. Closer to home, and I'm not sure if we have anyone from Southeast Community Links on the line today, but if we do.
Monique, it's Kitty McMahon from Wise.
Kit, I've just muted you. So closer to home, the Safer and Stronger Communities pilot project, which was published by our PrEP partners, Southeast Community Links, speaks to the critical nature of having people from cold and migrant refugee backgrounds integral in the planning and co-design for family violence prevention activities, and that culturally relevant tools be developed and created through this co-design process. This really important message of participation and voices informing the systems and structures was also clearly articulated in a COP that both Zoe and myself went to yesterday, led by the Multicultural Centre for Women's Health, and we have a couple of people here today from there. It is really true that for all health priority areas, to ensure the voices are being heard and represented in the workforce as well, and flipping that model on its head rather than labelling these populations as vulnerable or minority. So this theory also rings true for older people, younger people, women, LGBTI community, and the Pride and Prevention resource points that out for that community too. So I guess when we do position the voices of these populations marginalised by systems and structures, we begin to change these systems and structures to be more effective. And again, that message was super loud and clear in yesterday's COP, where many were speaking out about the cultural inappropriateness of decisions, services and programs for cold communities. So yeah, it was quite interesting and very very moving to be a part of that discussion. So anything else to add, Zoe, because you were in that as well? Otherwise we'll carry on.
I think, yeah, just echoing what you said, that it was very interesting to hear people in that communities of practice talk about how, there's a big effort from Family Safety Victoria, from the Orange Door, to be culturally inclusive in their family violence response. And we heard loud and clear from community organisations that work very closely with cold, migrant and refugee women, that, the funding needs to go to them and they need to work in a way which is led by their communities, instead of the funding sitting in mainstream organisations and them trying to branch out in a very colonial white capitalist paradigm.
Yeah, totally. Yeah, completely. Thanks, Zoe. Okay, so what this looks like. So we've got our three, bringing it back to our community health IHP lens in the forum. These are the top three IHP health priority areas that are shown here. So healthy eating, which is food, physical activity, movement, and tobacco, vaping, e-cigarettes, and smoking. So we'll now, I guess, unpack across these as a collective what applying a gender lens looks like practically. And the second part of the forum will obviously feature our community health service, Star Health, taking us through some of the work that they've done in recent times with that real practical application with their case studies. And they'll also share a tool that they've developed for their colleagues to use from a number of different resources, which is really exciting. Oh, Laura's clapping. Thanks, Laura. Okay, so in terms of healthy eating, so what we do know is when we're taking a gendered lens to healthy eating, that we are seeing, and this is taking a feminist perspective here, that there is a gendered nature to unpaid care work, which means that women are often time poor. Again, that gender pay gap impacts ability to afford healthy food, particularly with single parent households who may have less income. and a feminised workforce or casual work, as we heard before with COVID, where that's really been affected, where there's less or no income. And we all know that processed food is obviously far more affordable and cheaper, and in some cases accessible than fresh fruit and vegetables, which at the moment sadly are going up in price. So women's food access, behaviours and health outcomes are really strongly influenced by those determinants and that environment in which the food is prepared, shared and consumed. So there is also a food insecurity and domestic violence link from research that has been done. So I think once we start taking that lens to healthy eating, and this is obviously looking at the way in which it affects women, we can see that that is quite different. So what I'd like to do is to really kind of throw it out for a bit of discussion here around what people are already doing to apply a gendered lens to healthy eating. And we can probably take a couple of examples just in the interest of time and the fact that we all want to have a little tea break shortly and stop listening to my voice. But has anyone got some examples around what they are already doing to apply a gendered lens to healthy eating? Oh, so quiet. There must be something. I think it's interesting to note too that for women, there are real sort of gendered elements around not understanding changes that occur to the body during perimenopause or menopause, and those things are not being understood or widely spoken about and may result in distress to women due to those societal gender expectations. So I think in conversations with community health organisations that we've been having, movements such as the Health at Every Size movement, which I think has a conference coming up in June for those that might be interested, helps to really address that narrative by shifting the focus away from kind of thin and slim and shifting it to a focus of size diversity and inclusivity. And it has a real focus on healthy lifestyles and supporting access to affordable, nourishing foods and physical activities. So I think assumptions that somebody has a larger body, someone in a larger body has a sedentary lifestyle or poor eating habits is about, can really result in that discrimination and exclusion for those people, and, you know, is not okay. So in thinking about how we promote healthy eating as well, it's also looking about the imagery that we're using and making sure that that's representing diversity as well.
Yeah, I might just jump in. I think obviously the body image thing is really super important. I think one thing that I've been discussing with our multicultural engagement team in going out and doing health eating sessions or health information sessions in cold migrant and refugee communities is just the acknowledgement that as women they may face potentially limited mobility due to potentially not having access to transport, maybe restricted decision making in the family, could be across any cultural group, of course, but yeah, just that acknowledgement of the fact that you may not statistically as a woman be as enabled to make either healthy choices because of structural barriers or because of cultural elements that are playing out inside the family, and again noting that that could be happening in any family. But yeah, I guess just acknowledging in my point that we can't always change the structural barriers that women might be facing, but in acknowledging that they are there, and that a person doesn't need to feel necessarily kind of hopeless or blaming themselves for that, that there's an opportunity in that session to acknowledge it and unpack it in session, to create that sense of feeling acknowledged about what the barriers are.
Agency. Yeah, agency. Yeah.
Yeah.
Sam?
Thanks. I'm Sam from the City of Kingston Council. I might be slightly off track, but I was just thinking about linkages with the prevention of family violence space, and how traditionally with healthy eating, you know, a lot of that burden of meal preparation and planning, you know, falls to women to nourish the household. In the prevention space, we talk a lot about engaging men and boys, and I'm wondering if that kind of links in here as well, you know, engaging men and boys in some of those more, what haven't been traditional roles, but initiatives like community gardens and, you know, vegetable gardens in primary schools, and, or, you know, community level programs that see men engaged in cooking as well, that being more empowered around their own health and well-being, but sharing that role and responsibility sort of across and within households. Is that kind of along the lines?
Totally. Yeah, totally. And I think as well, masculinity in itself has, I read some research the other day that said it is associated with that kind of higher consumption of certain types of foods like meat, spicy foods, you know, like the spicier you can eat, the hotter you can eat, the better, the biggest piece of steak you can have, to, you know, build muscle mass or whatever it is. So, you know, there's all those constructs that sit around men as well. So I think, like you say, Sam, breaking those down and creating an environment whereby men and boys are more involved in those kind of traditionally, or what we call traditional female roles, is, you know, fantastic. So thanks for your contribution, Laura.
I was just thinking about the work that Enliven does to establish home and community gardens that are edible. So through some of their community outreach work, like the Grow Together program with the Southern Migrant and Refugee Centre, they kind of distributed seedlings and seeds for people to grow their own edible gardens, to help mitigate some of the cost of purchasing some of those expensive items like fruit and vegetables. And I don't work at Enliven, and I'm not sure, I think Tia, our star stakeholder, is unwell at the moment and not able to attend to speak to it. But I think that they did really have a focus on recruiting refugee and migrant women to participate in that program, as well as having the focus on sort of reducing the burden of groceries and the cost of groceries. It helped to create community cohesion among some of these groups and create a bit of connectivity between some of these communities as well. So I think there was a bit of a double benefit there.
Yeah, thanks, Laura. Okay, so I think in the interest of time, I'm just going to whip through to physical activity. So in terms of physical activity, we know that women experience different motivations to engage in physical activity. Children, especially girls, are less likely to be able to walk to school for safety reasons. Built environment and facilities impact on participation, and caring duties may be placed on women which limit their ability to participate in physical activity. So I guess throwing it open to the floor again, what are people already doing to apply a gendered lens to physical activity? And I'm also just going to, for 2 ticks, if possible, I just got a message saying my daughter hasn't turned up at school today, which is very strange. So I just need to go and see my husband. And Zoe, I'm going to get you to just facilitate this, and I'll be back in 2 ticks.
Sure thing. Cool.
Hi, Zoe. I'm happy to jump in there. It's Eva from Council, Frankston City Council. Yeah, so in our space, we've been looking at some gender inclusion within sporting clubs. So we last year we had a look, and within Frankston City there was women and girls were more likely to be insufficiently active, and it was higher than the state average. And that was also then transferred to less women and girls participating in sporting clubs in our region. So we'd actually worked with WISE last year and hosted some workshops within the community to look at what were the barriers and enablers to participation in sporting clubs for women and girls, and then try to work with them to create something that the clubs would be able to work towards. So looking at, within leaderships, within club culture, volunteers and employment, membership and engagement, creating a bit of a toolkit for them to be able to create more welcoming environments for women and girls. So yeah, it's been a bit of a process, and we've had WISE come along that journey with us. And we've just come to the point where we've launched this toolkit for clubs, and then hopefully getting some clubs on board to work through it. Created some resources as well. And yeah.
Fantastic. Even if you're comfortable to, we'd love to share those perhaps after today.
There's a link on our website, which I can pop in the chat now.
Oh, great. Amazing. Thanks, Eva. Thank you for sharing that great work, and it's been a pleasure to work with you on that piece. And we'll look forward to supporting that ongoingly. But anybody else want to share anything that they're doing in the physical activity, active living space?
Zoe, Dalal from Wellsprings and Kate both have their hands up.
Oh, fabulous. Thank you so much for pointing that out, Laura. Dalal, over to you.
Hi, everyone. Yes, at Wellsprings, we had a program for the last 2-3 years called Girls on the Move. And it was targeting young women from migrant refugee background to have a taster of different types of physical activities and involvement in sports. The issue we have faced with that is that most of the clubs, they want to recruit players or participants who are already, very good at that sport. So it's kind of like, it's either everything or nothing. Like there are opportunities to, like they approach us and want, or they say, oh, we want to try and diversify our clubs. We want to try and recruit women from different backgrounds, but they really want them to be at almost like an elite level of sport, which, there's a huge gap between where migrant refugee women who are almost, recently arrived, who haven't had much participation before in sports, and what they want them to be. So closing that gap is really is a challenge at the moment. So our program has been more about just we keep saying to them, look, our program is really about just getting them exposed to having more physical activities, whatever that is. It doesn't have to be joining a sporting club, because the barriers of joining a sporting club is still really doesn't suit the need of the women. So it's almost like having these women to fit into existing structures rather than changing the structures to meet the needs of their physical, what they want to do in terms of how they define physical activity and playing in a team.
Exactly. Thank you so much for sharing that, Dalal. And we had conversations with Eva and her work about exactly that, about that there needs to be a space within sporting clubs for non-competitive sport, as well as a space for, as you've just said there, Dalal, women who actually don't want to be part of a sporting club but still want to be active. Responding to that.
It just seems, though, that we are trying to fit into already patriarchal forms of sporting clubs.
Absolutely.
It's not what women want to do. And honestly, some of these clubs and some of these games are harmful. We don't want the women to have the same sort of harmful effect on their health because of playing. Even I have an issue with the AFL kind of things where women are having so many injuries, and we know that it's bad for the brain to have so many concussions and stuff like that. So I just don't know why we're going down that track of wanting to be exactly like the men. It's a bit of controversy.
I think there's so much work to do though, Dalal, even culturally in sporting clubs. You know, it's all very well bringing and wanting to increase women's participation in, let's say, for the moment, mainstream sporting clubs, but the culture needs to change first.
Yes.
We need to do healthy masculinities work en masse, and then, yeah, or simultaneously. But I hear your point as well that we don't need to always be thinking along the same lines as you know, men's sport, because it has been so culturally dominant.
Just an update, my child is at school. So I don't know what happened there, but they obviously pressed the wrong button when they were like checking her in this morning. But I was like slightly freaked out because I only saw it now and it came through at 9:45. So I was thinking, oh, that's very out of character for her not to turn up. But anyway, she's arrived, so it's all good. I can take a deep breath.
Good news.
Yeah, I think in terms of what you were saying, Dalal, I do a program called Soccer Mums or Go Soccer Mums, which I really love because of the fact that it's non-committal. I can turn up when it suits. I don't have to go when it doesn't. It's not competitive. It's just fun, having a laugh, people of all shapes and sizes and, you know, diversity there. If you wanted to get involved in the club, which I think is part of an intention of it as well, to build more women's teams, you can. But I find that for me works really well and is a nice way to kind of entry into doing, you know, team sport, which is something that lots of women don't do. And it's super fun. Just have to be a little bit careful about, you know, injuries and things like that. But
just before we go to tea break, we did have hands from Kate and Karen, if we had time for any sharings from them.
I can just be really quick because I think Dalal said quite a lot of the stuff that I was going to say anyway, actually, just to say that at Port Phillip, we're sort of doing our first gender impact assessment, looking at some of our public space and sporting facilities at JL Murphy in Port Melbourne, and looking at it from a gender perspective, looking at if it's meeting the needs of people of different genders, looking at the sort of the allocations, and, you know, making sure that, you know, any sort of budget and projects aren't just looking to kind of, you know, improve the structured sporting facilities that will predominantly benefit the men and boys, that we're also looking at the kind of uses that women, you know, tend to want from that space, being more around walking and running and the unstructured sort of sports and unstructured kind of, you know, recreation, and just making sure that there's some, you know, fairness in some of those decisions around, you know, what we kind of invest in terms of improvements, looking at things like, you know, some of the kind of, you know, safety and lighting and that kind of stuff as well. So really just following on from what Dalal was saying, but we're also looking at the impact of kind of playing surfaces and injury risk, which is maybe different for women and men. So yeah, we're doing our first gender impact assessment and looking at all of these kind of issues in our sports and rec space as well.
That's fantastic. And community health organisations can really tap into that too. And, you know, reference some of that information, I imagine, with council in partnership to help kind of strengthen their work as well. I know even with like those outdoor exercise stations, sometimes historically they've been things like pull-ups and things that I certainly know as a woman, unless I was, you know, going to the gym a lot, I'm not going to be able to do a chin-up. So it's even thinking about things like that, whether they're you know, structured to women and people who may not have that same strength to participate in. Karen, you had your hand up.
Yeah, I'll just keep my camera off for the moment. Yeah, I guess I just wanted to add to the previous conversation in that a few years ago, Stonington developed the Active Stonington framework, and it was kind of council's first real shift away from, I guess, its ongoing investment and support of mainly the sporting club kind of infrastructure as being the sort of sole way of kind of pursuing physical activity increases in participation. And it was really, it really sort of acknowledged, well, number one, that membership in sporting clubs was waning, but rather than just sort of saying, well, we need to do more to make sure people are seeking out clubs and to do physical activity, it kind of acknowledged that there needs to be just as many platforms and mechanisms for people to be active outside of the club environment. So it very much switched the focus of what council was doing to support social sport, to support that incidental exercise that you could get, going about your daily business, going to parks, going to open spaces and that sort of thing. And I guess it sort of picked up what Vic Health was saying, that, the biggest increases or the biggest gains to be made in physical activity were by targeting those that are inactive, and so not just focusing on sport. So that was a real shift for us through that new framework.
Yeah, great. Thank you, Karen. Thanks for that input. In the interest of time, Zoe, I'm just wondering, do we want to speak to the tobacco or come back? I'm just looking at the timing here and conscious of people needing to have a little short break. So maybe, do you think we could go to a short, let's go to a short break and then we'll come back and quickly chat through the tobacco, and then we have our guest presenters who we definitely want to hear from, Sally and Danny, speaking to some of their work that they've done. So how about, I've got 10:34, if we can come back at 10:40, does that work? 6 minutes, cup of tea, quick refreshment break. Welcome to turn your camera off and then just pop back. Thanks, people. See you soon. Hello. Hello, everybody.
Hello, Kate. How are you?
Hi, I'm good, thanks. Very well. Hi, Dad. I'm going to stop sharing my screen. Oh, actually, Zoe, are we going to head through to the tobacco and then throw to...
Yep.
I think we'll do that.
I'll just touch on it quickly.
Okay. So if you can maybe just give us a thumbs up to show that you're back in the room. If you haven't got your camera on, that would be great. Just so we make sure we're not chatting to an empty room.
Go for it.
Awesome. Thank you. Okay, so I'm going to throw to Zoe, who's going to talk around a gender analysis around smoking and e-cigarettes.
Thanks, Kat. So we thought we'd just include smoking cessation, given that it is a priority area in the Victorian Public Health and Wellbeing Plan, as well as one of the top 3 areas in the community health, integrated health promotion planning work. So really great opportunity, I think, today to have a bit of a chat about smoking cessation and how it is smoking behaviours are gendered. So yeah, just thinking about the rates of smoking in Australia, you can see there on the right, there's a chart which maps the daily smokers by age and sex in Australia. And yeah, like many other countries in Australia, smoking behaviour is not hugely gendered, but it is inversely related to socioeconomic status, with disadvantaged groups in the population being much more likely to take up and continue smoking. And yeah, just that really, really strong link with poverty, if you like, and smoking behaviours. So just acknowledging that there is a gendered element, I think, to e-cigarettes, which typically is attracting more young women, or certainly more young people. But that when it comes to gender, there's not a huge discrepancy or disparity, other than it impacting those in the lower socioeconomic groups. And if you move to the next slide, I just wanted to draw the attention to the fact that the industry big tobacco has massively tapped into and benefited from harmful gendered ideals of, on the left there, that idea of smoking being rebellious and something that kind of goes against femininity and feminist movements, goes against femininity, and it's kind of a rebellion and rejection of traditional femininity. And there on the right there, the image of harmful gendered ideals of thinness, and promoting that idea of an alignment between smoking and being thin, which is obviously pretty problematic. And if you move to the next slide, I was doing some reading yesterday, which people probably know, but was new to me, that social media, there's a lot of advertising, particularly in Europe, that's happening through selfies. Social media influencers are using tobacco-related hashtags, and young women, particularly in Europe, are being impacted by this. And there's a lot of increase in uptake in women smoking, particularly e-cigarettes, but also smoking. I'm not actually sure if that's happening in Australia. I certainly haven't seen it in my feed, so maybe that's something people might want to comment on. But yes, problems arising or have arisen around young people and e-cigarettes or vaping, and noting that in a recent survey of Aussie school kids, 14% of students said that they had smoked in the last month. So I didn't grab anything gendered in that data and that study. There was nothing there. There may be some stuff, but I didn't find any yesterday. So really keen to hear what your thoughts are on this area of work. It's pretty new, I think, for us at WISE to be talking about smoking cessation and gender. So we're kind of here to learn and hear from you as a sector as to what work's happening out there, how you're applying a gender lens if you are, and how we can strengthen that intersectional approach to this work into the future in our region. So yeah, Kaylee, you've put your hand up.
Yes, hello. I'm going to just leave my camera off because it seems to help my internet connection. I think we've all experienced that challenge. Just wanted to comment on the vaping, just what I've observed in my role. So I'm in the youth services team at Kidinia, and we have definitely seen a lot of the young women that attend our groups and programs have taken up vaping, not anywhere near as much as prevalent with young men that we see. But I think a lot of that, just in conversations with these young women, a lot of that comes down to even like the different flavors and stuff. Like it's very much, I think, the laws around it are tightening up, I believe, but they're still fairly loose around what's legal in terms of accessing e-cigarettes or vaping, and whether it's got nicotine or not impacts on whether it is or isn't illegal technically. So there's kind of some murky waters there, and even just like the way that they are I guess made, the flavors that you can get bubblegum and cinnamon and all these different, I guess, typically targeting young, like it seems to me that it's very typically targeting young women that want to have something bubblegum flavored, for example. That's generally not as appealing to the young men that we would work with. So definitely seeing that there's there's definitely a trend that's rapidly growing with the young women that we see out here.
Thank you so much for sharing that, Kelly. And Laura's just popped a question in the chat. Don't know if you can see it around. Is there any discussion that you've heard around it being an appetite suppressant and maybe linking in with body image?
I absolutely have heard a lot of young women have that thought process of, instead of eating, I mean, not even just young women, I can say even adult women that I've spoken to sort of go, oh, maybe instead of reaching for that block of chocolate, if I vaped instead, well, then maybe, no, so I don't know so much about an appetite suppressant, but I know that there is definitely thought processes around it being potentially a healthier alternative than a sugary snack, which is concerning. But yeah, and I saw there was another comment too around it being illegal for under 18s, which I understand is the law. And I find that it's interesting that these products seem to be designed to mostly appeal to younger people. And I think, and I could be wrong because I know that there was some recent change in the laws around it, but I think it's illegal to sell to young people, and it's illegal to advertise them, but it's not illegal to have, especially if it's not a nicotine based vaping device. I could be wrong on that, but I know my workplace has recently tried to really look into that, to put a policy in place for, at least in our context, when young people are attending our programs, do we treat vaping the same as we would treat smoking, and say that it isn't allowed? Or is there like loopholes? Because the young people are very quick at getting through, but I'm allowed to do this because it doesn't have nicotine in it. They'll tell us that straight off the bat. So we've tried to make sure that we're really clear around what our policy and our stance is, and what the law is. And I'm not totally up with what the latest change is. I know that there was some change to the law, but I still think it's not nearly tight enough. And the people that are producing the vaping devices are surely very aware of who they're targeting and how they're making these things that are, very obviously. I think the last time I saw something similar to this was like, alcohol icy poles and the flavors you can get in those things. Like it's like, come on, let's be real. You're obviously targeting who you're targeting. Like it's pretty obvious. Sorry. So that's just all my anecdotal.
Yeah, no, I think thank you for sharing, because I think, feels like, certainly I feel like there's a lot to learn in this area of work. So it's really great to get your anecdotal stories in the room here today. Dalal, you've got your hand up.
Yeah, sorry. Another phenomenon related to smoking is the prevalence now of the shisha. A lot of the migrant communities, including the one I come from, it's very popular. And I actually think that they think that it is healthier, even because it's not going through the paper, it's going through the water, that it's less harmful. But the thing is that there is so much lack of education and information about the harms of using a shisha, because it's kind of like almost like smoking 10 cigarettes.
Yeah, okay. And is it people of all genders smoking shisha?
Yeah, it's quite
Yeah.
popular with women. Definitely.
Okay, that's interesting. I had it down as a typically more male behavior, but that's interesting to hear.
I've had some of the women who are with us who, when we go off to, you know, like weekends away or something, asking me if they could bring the shisha with them. You know, it's
Yeah, okay.
it's yeah. So there needs to be, and what is bothering also is, like, you know, you have these shisha cafes now dedicated for it. That space.
Yeah.
Very amongst
Yeah.
young people, they're very popular, and because it's also the tobacco is flavored, and you know, with, you know, different types of flavors, so you actually you don't get that same taste as you would do from a cigarette, so it's kind of very pleasant. I'm not promoting it, guys, but I'm just saying why why so many people like, you know, like using it. Yeah.
Thank you, Dalal. Thank you. Woodad, I can see you've got your hand up as well.
Yes,
Go for
thank
it.
you. Thank
Welcome.
you. Yes, I just would like to add on what Dalal has said. Yes, I think Dalal is referring to Middle Eastern culture in Lebanon and so on. And also would like to add in African perspective, especially in the Horn of Africa, the culture is very common. Women perceives it as if this is a very relaxing setting, you know, with lots of decoration, flowers and so on. And they smoke this tobacco, and it's always a concern. Sometimes I work as interpreter in maternal and child health settings, especially, and when they are asked, you know, for health assessment, does anyone smoke at home? No, you know, so it's not even considered and known as smoking, but the harm is just infiltrating, you know, in the house, and children are harmed by it, and mothers are harmed by it, and there is a lot of awareness need to be done in those areas.
Okay, so passively impacting children and in the home.
Yeah, and women.
Passive smoke,
Well,
yeah. Okay.
yeah, and women are not aware of the harm. It's perceived as if this is a very relaxing, fruit flavored, and, you know, and so on.
Yeah, and are you aware of any work we'd add in the region to bring more awareness to those communities, or is that not happening yet?
Not that I know of. However, at population health teams that I'm working at Monash Health, we have Katrina, who is working on smoking harm project. She is raising awareness among Monash Health. The problem is shisha is not included very much into smoking.
Yeah.
Yeah.
Okay.
Yeah, and the way they market it also, I don't think they will get taxed as much as cigarette. That's my understanding.
Yeah, great. Well, what a really important point that you've highlighted today, and I think that you know, that certainly raised awareness from where I'm sitting, and perhaps as a team at WISE with the multicultural engagement team, we could look to get involved into some of that work into the future.
So that real intersectional gender lens is just super important, of course, with,
yeah,
you know, hearing the voices of different women in different cultures and how that's different in different spaces, and so yeah, it's super important and really relevant. So thanks for sharing today. Sorry, Zoe, what were you going to say?
Oh no, nothing.
Okay. What we might do is throw to our wonderful guest speakers today. So I am going to stop sharing here. And I would like to introduce you to Danny McCaffrey and Sally Rossiter, who are both health promotion officers at Star Health. They are also WISE Pret partners and Good Health Down South, which is our sexual and reproductive health strategy partners, and regular kind of attendants and participants in our regional activities to prevent gender violence and improve SRH. So Both Sally and Danny are experienced health promotion officers, and they're going to share today with us 3 project case studies whereby a gender lens approach to planning and practice was taken, and a useful tool, as I mentioned, they've developed. So if you can please give a warm Zoom welcome to Sally and Danny.
Hi everyone, can everybody see that the screen, the applying a gender lens? Yeah, brilliant. Yeah, so we've been working in this space for the last couple of years, and so we've got a few case studies. Sal and I will go over with you today. So as Kat said before, that using a gender lens when analysing, planning and making decisions means that you're carefully and deliberately examining all of the implications of our work in terms of gender. So it highlights the ways in which our work affects people of different genders. In this presentation, we'll take you through some of the ways we've used a gender lens in different situations, and how some of our early learning service educators have used different tools, and some of the lessons we've learned throughout the process. So the first example that we have is that we've not created these tools. We've taken them from other people, organisations. So this was from Darabin's Creating Gender Equity in the Early Years. It's an audit tool, 1 of 3. And we shared it with the early learning services that we were working with, so that they could start gathering the data around what's actually happening in their services. And so they really took these audit tools and analysis tools and ran with them. And they didn't just use this, but they used observational assessments to look at their use of space, where girls and boys were spending most of their time. And these tools really help them think through and ask themselves, where the children were actually spending most of their time, what they were playing with and why. So they involved the voices of children as well. They had a series of questions that they could ask the children, which was really fun. And we got some recordings of kids, 4-year-olds having a chat about why they liked working with the, what they liked playing with and stuff, which was really fun. So, and then once they've gathered all of that data, they took it back to the staff and had a discussion and, talked about what they'd found and then what they could do differently, and got the staff's reflections on what the situation was and how it could change. So one kindergarten in Stonington had a look at one 4-year-old class made up of about 29 children, 13 girls and 16 boys, and they conducted a classroom gender map assessment. So they took they drew pictures at 15-minute intervals of where all of the boys and girls were at each of those slices of time, I suppose, over the day from 8:30 till 3. And what they found was that the construction area was predominantly used by boys, and for longer periods of time. So when the girls did engage in that space, it was for shorter periods, and they often brought other toys from the room to use in that space. The book area was accessed equally throughout the day by both girls and boys, and the Lego was used equally, but boys spent longer in that space with the Lego. And dramatic play was used equally, as was the art and collage space was used predominantly by the girls. So the staff looked at that, took all of that data back over that day, and decided that they would move the construction area into the middle of the room and make it bigger. and they involve the parents in gathering some construction materials. So they got them to donate boxes and, you know, cardboard and stuff like that from home of all different shapes and sizes. And the teachers spent time in that area, you know, with the children. So they created a space where the children could keep all of their pieces that they created, so that they could sort of come back to it over the week, and they were encouraged to continue learning over a period of time. So what happens, the result of, you know, moving the construction area, making it larger, was that it was a really well-used space. It was really busy, with both boys and girls working together. So this was helped by the addition of a teacher assisting with all of the creation, and the children took turns using the iPad to document and display their work. The collage area was the most popular, well, it was really popular with the children. So they moved things around the room, and having the parents involved in the collection process meant that the children came to the centre with new ideas of what they wanted to build that day. So they reported that there was a lot more collaboration between the children, and they worked in small pairs and small groups to complete structures. So the conclusion in just, you know, this small experiment was that focusing attention on the physical space and gathering data and making small changes to the environment made a significant difference to how the children interacted with each other and with that space. So I'll throw to Sally.
So I'm just going to talk a little bit about the work that we've been doing internally at Star Health. So Star Health, I think most people know, is a community health service. And we have a gender equality committee that we've formed some time ago. And on that journey, we've done some training with our managers and coordinators around looking at what gender equality is and why it's important. And we've also, the committee has developed a number of resources to support staff in their work. And we've created a gender equality tile on our intranet, and we've loaded up all these tools so that staff can dip into those. But one of the tools that we thought that would be really beneficial for taking our organisation from a sort of gender blind to a gender transformative type organisation was to develop a tool that staff could use. And in developing that up, we got lots of input from people. And I guess one of the key messages is that, you know, staff are really busy, clinicians are really busy. We wanted a tool that we could use in different segments of our organisation, from policy to quality to HR to clinicians on the ground. And so we looked at lots of resources, and we thought that the Women's Health in the North communication guide had some really good reflective questions. So what we wanted to do is have something that was simple, user-friendly, and that also started to consider that elements of sort of intersectionality as well. And you can see on the slide some of the questions that are covered in the tool. And so we thought that these questions were really good to staff to be able to apply for their planning, you know, new activities, but also reviewing and monitoring processes in the work that they do, in communications, the way they are delivered in the organisation and developed, and also for clinicians, and to look at their individual practice so that they could do some self-reflection and some, you know, and for case reviews. So the tool has this set of questions, but also has some terminology that staff needed to know, and also some little examples about how they could apply the tool. And we sort of encourage that they do it with a group and get different perspectives. And I guess the tool, as you can see, is, you know, thinking about how things affect women and men and gender diverse people differently, you know, challenging our assumptions, and thinking about in our work and our activities that we're doing, are we sort of either reducing, maintaining, or increasing gender inequalities? And, you know, are we reinforcing or challenging gender stereotypes and roles? And I think so that's a bit of the work that we're doing, and now we're dipping in our sort of testing the tool across the organisation, and we're doing having lots of conversations with staff around the tool. So I'll hand over to Dan, because our health promotion team actually did a little trial, a little test of the tool.
Sorry, I need to unmute myself. The second example was that we took the tool and did a little test. We were running tuning into kids and teens as a sort of partnership project under the banner of Communities That Care. And it's a parenting program that builds parents and carers' capacity to connect with their children. And we've been running it for a number of years, and it was promoted through early learning services and primary schools and secondary schools, as well as being referred through our clinicians. So what we did is we had to sit down and we went through those reflection questions, and we also sent out a survey to our staff around that we knew that were parents, and asked them, you know, what would increase their participation in a program like this, and particularly focusing on male participation, because what we found was that participants were predominantly female and the facilitators were all female. So this was sort of reinforcing the idea that emotion coaching and parenting and connecting with children on an emotional level was the role of females and female carers. The imagery that we used in the flyers and things were pretty good, 50-50. We used pictures of dads and boys in the promotion. But we noticed that the time that we offered the program was during work hours. So we didn't have any offering after business hours, which may have been a barrier to further participation by a diversity of parents. So the other thing was that pre-COVID, we only offered this face-to-face. Obviously in COVID, during the lockdowns, we had to go online, which also, you know, we talked a lot about how there was a digital inclusion element of that. You know, it assumes that people have access to laptops and data and, you know, all of the things that requires people to access, you know, Zoom calls like this. The conclusion was that we were sort of unconsciously, like I said, reinforcing emotional regulation is the mother's role, or, you know, female carer's role. So what we tried to change was that we deliberately trained up some male facilitators so that we could counter that narrative that that emotional work is only for women. And we made sure that all of the flyers were 50-50 male and female carers. We also encouraged the provision of you know, the after hours facilitation of the course. However, we found that that needs some more exploration and possibly funding specifically for after hours. The outcome is that we now have male facilitators. We have a number of male facilitators, and we've had more men participate. So we're planning to offer a dads only tuning into kids program this year, and see if we could get more dads to participate. I think when we did some information sessions in the early years space, we specifically promoted to fathers, and mums still turned up. So it won't preclude you know, all parents from getting involved, but maybe promoting specifically to dads might have an increased uptake of male carers. So
And I think our RAV, or Relationships Australia Vic, are doing some culturally diverse, specific tuning into kids for Afghan dads, but have had with engaging. So yeah, it's great work.
So I'll throw back to Sally.
Now, our third example is more about as our role as health promoters is sort of advocating and looking for opportunities where we can influence and opportunities for, you know, how we can apply a gender lens. So some of our colleagues, Lizzie and Jess, are working on the South Melbourne Capacity Building Initiative, and that's an initiative that's in a partnership between Star Health and Council and the Department of Housing, and it's looking at a social housing site in South Melbourne, which is a high-rise site. So at the site, there's a mixture of older families, young families, and quite a few sort of single men who live in this facility. So they've done quite a lot of work about engaging the residents. And one of the things that came up as an issue was safety. So a part of that, they thought, well, let's get in Vic Police to undertake one of their crime prevention through environmental design assessments. So anyone can actually ask the police to come and do this at a business or a home, and it sort of assesses your, you know, building for, you know, where you may have weak spots for people to enter the building and, you know, rob you or whatever, commit a crime. So what we wanted to do is to try and usually what they would do is the police would walk around with maybe a couple of residents around the building and then do an assessment and make some recommendations, or walk around with the Department of Housing. So what we wanted to do was to ensure that women's voices were included in this activity, because we know that women and men and gender diverse people have different perceptions of community safety. And so to do that, we advocated, and Lizzie and Jess got a group of diverse women around and did a walkthrough with them. And what they identified were some of the concerns. So, and I think that was, you know, internally concerns were around the communal laundries, which had doors that could be locked. And so women felt that they could be trapped in those laundries, and the stairways and the corridors were areas of concern. And then they did a visual map to see where there were some points that women were feeling less safe. And you can see around that there were sort of areas in the car park, even the playground, sort of working out how to get to the playground and where they, you know, women with children would sit. The entryway, they always felt that there was a lot of tension around the front entryway, and also the trans stop where they were getting on and off trams, and then a pathway leading to another entry. They felt that that was secured and often not in the line of sight to the security guards that are at the building. So they took that information and they added that to the additional data, to the other data, to build up a much better experience of lived experience of people. And from that, they sort of submitted something for change, to make changes to the Department of Housing. And as we know with, I guess, some of these things, you know, it does take time to implement the changes. But I think the key message is that, you know, for the first time, those voices of people, of women, were included in the data collection. So I think that's sort of the key message. And in doing that process, it also built up some of the capacity of people, because we looked at some other resources too. So when Lizzie and Jess were sort of forming up those questions that they were going to ask the residents, they were looked at some resources on the next slide, I think, Dan, that you can have gender sensitive design was a good tool to look at, and looking at like around lighting, the flow of traffic along routes, thinking about a line of sight, and And the other place that we dipped into was also another resource from the city of Whittlesea that got gender equity in design guidelines. So I think this is a really good, because it sort of looks at specific sort of certain sort of buildings like maternal and child health. If you're building a community pavilion or designing other health services and things like that, you can look at this, and it goes through a series of what you need to be considering. And the other resource that we thought was really quite good too was the Women's Health in the East, creating safe and inclusive public spaces for women. So they've got a really good report that they put out in September 2021. And I think that's a really good resource too. And I think as health promoters, we can work quite closely with council too, because often there's a lot of upgrading of local parks and outdoor spaces that we can encourage councils to ensure that they do apply a gender lens to those areas. So I think, Dan, in our conclusion, did you want to speak to this?
I think the transferable sort of ideas from all of these different tools is to involve the end users in the process of doing the audit or an assessment, to gather data together and build a picture of how things are currently. And I think that can be a really important tool in getting people on your side for a lot of this work as well. And using reflective questions around once you've gathered that data, but that, focusing your attention on a particular area or aspect of work, just doing that can start shifting things. And that when you're doing this, there's nothing stopping you from looking at how this affects, people from gender diverse backgrounds, from COLD backgrounds, from, LGBTQI back, you can take an intersectional approach. And an example of that was our book audits. The Access Health tool takes into account all of those sorts of things as well. I think that's about it. Yeah. Is there anything else, Sal?
And I think with our tool, what it has sparked is that, it's a good starting point. And I think as we test it, we'll modify it. There's also a lot of interest at Star Health about, as an organisation, developing an intersectional framework. And so I guess, at the moment, we've got quite a lot of different sort of working groups, from our diversity working group to our gender equity working group, health literacy and rainbow tick. So I think it'll be just a joining together and how we can apply a really good approach. And I think it's the documenting of the case studies is really important work around building up the cases about what was before, and then what you did, and then what changed because of that. Developing up that really good storytelling is great. And yeah, I think the tool also promotes that sort of, you've got something that you can give people when you see that there's an opportunity to make a difference. Thanks.
Thank you so much. That was super valuable and really fabulous to hear those real life examples of the application of a gender lens and intersectional lens through your practice as well, which is fabulous. I think the feedback that's coming through in the chat has been really positive. So really appreciate you presenting that today, both Sally and Danny. Okay, so I am just going to share my screen again. Oops, excuse me, 2 ticks. I'm going to move that up there. There's my presenter window going. Stop that. technical issues, gotta love them. When you're using two screens, it's fun, isn't it? Okay, can we all see that? Yep, awesome. So what I wanted to do here, is just, oh goodness, I've gone right back to the end, I mean to the start, is just to really, I guess, speak to the fact that, as I mentioned at the start, and as Danny and Sally have alluded to through their presentation, there are a whole stack of tools available that are out there that you can use to inform your work. And they are certainly, you know, there's a selection of them on the slide here. So we will, as I mentioned, distribute those to everyone so that you have access to tap into those things. So just moving forward, we have got approximately 10 minutes left. Now, we intended to have a panel discussion to kind of throw it open and see if there were any questions, any burning questions that anyone had. We did have a couple of questions that came through from the floor in terms of the registration. So what we could do is answer those questions up front, or we could throw it out. Zoe, do you have any suggestions on what might be best at this point, just with the limited time that we've got?
Open. Okay.
Throw it open. Okay. I do, while we're throwing it open, I'm actually going to just do a quick plug for our evaluation, because we can't forget about that. At WISE, I mentioned at the start, we have a strong commitment to the social value of the work that we do, and putting a value on the work that Women's Health Services do, which has been recognised in the recent budget, which is fabulous. But that means that we need to be able to, you know, prove this work. So we'd really appreciate your feedback on today's session. You can QR code, everyone knows how to do that, of course. Otherwise, Laura's going to put the link in the chat, and I will also send it out as in an email to everyone at the end. So if you just want to plug away on that, it'll take a minute for you to finish. And we will, I guess, go to a bit of a panel discussion now. The other thing I want to quickly say is we obviously don't want you to miss out on getting involved. So those people who are not involved in the PrEP partnership, you are welcome to join us and make sure that you're on the mailing list for future events. Just shoot me an email and we can get that organised for you to make sure that you're kept up to speed with what's happening. Okay, I'm actually going to stop share so that you can see us. And we've got all the panel members pinned to the screen there. So welcome, Kit. Nice to see you. Kit's our CEO at WISE. We have Dalal Smiley, who's the CEO from Wellsprings for Women, who are a fabulous organisation based in Dandenong, working with women from many diverse backgrounds and do some amazing programs. Obviously Zoe and Danny and Sally, who you've both heard from today. So just opening it up to the floor, really. Do we have any questions, any burning questions from anyone today? Please just put your hand up. Or
Kat, it's Kitty. I might, while people are thinking about it, just make some observations from the incredible presentations that we heard. I think what the group of organisations, which is all of us, are learning as we implement the Gender Equality Act, is that GIA, GEEPS, gender lens work is actually a moment to encourage our colleagues, our teams, our organisations to reflect and to plan, which is actually something that I'm learning doesn't happen enough anyway. So that's one of the first barriers, is using these opportunities and drivers through the Gender Equality Act to make our organisations stop and actually ask a question we, I think, all want to ask, which is, are our programs, services and activities delivering the best outcomes for our community. Because that then gets you to ask, well, hang on, do we know who our community is? And then that gets you to ask is, challenge your own assumptions. So I think that kind of forced reflection, for want of a better term, is something that we're finding when we do these activities is often the first thing is oh, I've got to cancel that meeting, sorry, something else more important's come up. It actually enables you to go, well, how serious are we here? Yeah, I think that's the first thing. I think the second thing is that the checklists and everything are great, but we've got to realise that they're not the ends, they're the means to the end. And the end is transformational change. And one of the things I think we need to be aware of when we actually go to those checklists is that we're actually not making those transformational change if we just deal with changing the people, right? That actually what we've got to do is we've got to change the systems and the structures that lead to the way that people behave and think and do their work. So some of the, so when we look at those checklists and the tools, they're not the procedure, they're the enablers to get us to do that thing called reflection. And I think all the examples that we've shown today are really about workers, frontline workers, who I would observe and need to be supported by senior leadership in this. Really trying to drive that practice and use whatever's at their disposal to actually get people in to do that reflection piece. So congratulations to everyone. And can I just say that your local women's health service is a good stirrer. Yeah, we can absolutely go in there and have those conversations, the hard conversations, which, look, let's be honest, when we do this work, they can put workers at risk. Yeah. So that's my observations, and I want to congratulate everyone who's doing it, the hard yards, to get this happen, because it is slog, but it does deliver outcomes. We know that. The evidence is there. So congratulations.
Thanks, Kit. Do we have any questions or reflections from the floor? Don't be shy. Surely there's a burning question there or a reflection that somebody might have. Prue, it's lovely to see you here too. I know that we're new to the network as such. So yeah, Prue's a secondary school nurse. So yeah, lovely to have that diversity and represented in the room.
Can I just say something? I just want to say thank you, because it's really good as a secondary school nurse in a big high school with no other nurses. In my role with me, it can be a little bit lonely, but also a little bit, you can get a bit starved for knowledge. So this is just a delight. There's no kids on site today. So for me, this has been wonderful to have dedicated time just to learn, and from such a diverse group of people. So yeah, we're planning some things here. So this has been really good fodder to move forward. Thank you.
Fabulous. And of course, this work is all connecting through to Respectful Relationships curriculum. We run the Critical Friends Network. We have lots of practitioners involved in that. Danny and Sally, even themselves, working with schools to help them implement respectful relationships and kind of guide them through that process as a critical friend. So it's fabulous, and thanks for your reflections, Prue. Anyone else?
Kat, we've got a hand from Dalal.
Yes, Dalal. Sorry, I'm looking up the top.
Hi. Yeah, look, I just wanted to oh gosh, where'd you go? Sorry, I lost you for a minute. Sorry, everyone. Before everybody goes, since I didn't have the chance to say a few things in relation to our work at Wellsprings, I wanted to mention that because we are a women-only organization, the majority of the women we work with are of migrant refugee background. What we're doing at Wellsprings is, in order to address gender equality, is to embed gender equality concepts throughout our adult education classes. So whether women come to do very basic English to doing advanced or computer or whatever, it's embedded in all the courses. We also, because we are working with women with low English proficiency and literacy, and also low education background from their own background, we've developed a lot of tools that are not language-based, but more image-based. So we have a lot of these resources on our website. If you go to our website and you go to the resources hub, you can download posters and cards that we use to create conversations with women around those images. And we've made them into coloring books as well for children and for so yeah, just check them out on our website. They're available for everybody. And I think that's been a challenge, is about working with women who have low literacy and in their own language and low English literacy. So we had to develop things that we could utilize that's not really based on having that English proficiency.
Yeah, they're wonderful tools, and we'll include those in our email that goes out to us so that people can access them too. Great posters. Sally's waving. Yes, Sally.
Oh, I was just going to mention too, the other thing that Dan organised for our organisation last week was getting Women with Disabilities Victoria to come and talk at a lunchtime session. And I think that was terrific because it does give us another sort of intersectionality lens. But also they've got some fabulous tools. And what was really good was that we had like about 25 people in the session, but we had some key people around policy, HR, our quality person, clinicians. So we had quite a broad range of people who, who were able to hear that information and to be able to include it in their thinking. So I think it's really important about in making sure who's in the room when you're doing these things.
Totally, the voices are being heard. So with my time showing 11:32, we've gone a couple of minutes over, but I think today's been a really wonderful opportunity to share our practice and learn from each other, and just, I guess, the beginning of this conversation. So if you haven't already, I'm going to plug the survey again. If you can please do the evaluation survey, we would very much appreciate it. And thank you to everyone attending today. We hope to see you next time. Bye. Thanks to our panel too. Thank you.
Thank you.
Is that your dog? Poor little guy.
Yeah, listen to him, he's howling.
I'm glad your daughter's at school. Thank goodness.
Oh God, I know. I just had it, and I saw it like half an hour